So in this question, they're asking events occurring at the level of insertion of coracobrachialis. Coraco, brachialis. Okay, this is a muscle from coracoid process of your scapula to the humerus. Coracobrachialis, they are not asking about coracobrachialis origin, insertion. No, they are asking something very special. Events occurring at the level of insertion. So where is it? Where will this muscle insert? Somewhere in the humerus. Okay. So at that level of humerus, what happens is what they're asking for 5 marks in the recent anatomy theory final MBBS paper. Okay. So look at coracobrachialis. Where is coracobrachialis? Here it is. So coracobrachialis, if they had asked you origin, you will say coracoid process, insertion mid of somewhere humerus, and what will it? What is the nerve supply? It's musculocutaneous nerve coming from the brachial plexus. And what is the action? It will flex the arm at the shoulder joint. It will flex the arm. So you would have said this, but they have not asked that. They're asking you what happens here. What are the events that are occurring here at the insertion of the coracobrachialis? So at the insertion is where, first of all, you mentioned that it is at the middle of the humerus. Okay. I think this 5 centimeter I didn't understand. No guys, that 5 centimeter is correct only. So you just remember that somewhere here 5 centimeter. So in the medial border of the humerus it will insert, and it's the middle 5 centimeter of this medial border. Okay, this will insert. So this insertion you have to know. Then only you will be able to tell what are the events occurring, right? So shall we move to the events, guys? Okay, now look at the events. The events we will divide like this. Okay, there are so many headings. Let us look one by one. What and all are there here, okay, that you will always say artery, vein, nerve, muscle, all this you will say, right? Usually anywhere you will say artery, vein, nerve, muscle, also remember some muscles, then bone. Bone itself is there here, some changes to the bone, and then some facial septa, okay, septa of the muscle. It is an intermuscular septa, okay. It's nothing to do with your face. It is fascia of the muscle, okay. Now let's look at this bone. Now bone, what is happening, right? Guys, focus here. Bone, what is happening? Whatever is circular here, here it is becoming triangular. Okay, the circular shaft becomes triangular below this level. Okay, done. 1 point done. Facial septa. This is something to do with the intermuscular septa. It becomes better defined from this level down. So where were we, guys? Facial septa, is it? Okay. So below this level, the facial septa will become, the intermuscular septa, right? It will become better defined. Okay. So the medial and the lateral, both medial and the lateral intermuscular septa becomes well defined, better defined from this level down. Okay. So that is why this point is very important. No, this point is very important because in the exam they have asked this question. Okay, so now let's go to muscles, guys. Muscles. So who insert at this point? Deltoid and coracobrachialis. Deltoid and coracobrachialis insert at this point. Who originate at this point? Brachialis and medial head of tricep. Originate. Where brachialis originates at this point, which is at the insertion of coracobrachialis and even the medial head of tricep brachii. This much if you know, it's enough. Now let's understand arteries. This is a little complex. You will have to understand this one. Easy ones first you see off. Okay, the nutrient arteries, they know it will enter the humerus at this point only. That whole nutrient foramen for this humerus to get all the blood nutrition. So where is it entering? At this point. Okay, so this is about artery. One artery done. Which artery? Nutrient artery of this humerus. Okay, then look at this. Here you have axillary artery, then it is becoming brachial artery. What is there here? Axillary artery, then it is becoming what? Brachial artery. So easy. Now what this brachial artery will do? No, it is medial. No, it will go off little anterior. So whatever was medial, now it is becoming little anterior. Okay. From then from this brachial artery, no, there is one branch that comes out and it goes behind that in the spiral groove. That is the profunda brachii artery or a deep brachii artery. Okay, so just say the profunda brachii artery. It goes in the spiral groove and it comes out and it gives some branches. Okay, that's all you have to say. Profunda brachii artery will go in the spiral groove and the posterior part. Okay, and it will come and give some branches. Done. Then I think that much is enough, right, about artery. Oh no, guys, one more point is there. This ulnar collateral, superior ulnar collateral is there. See this one. The superior ulnar collateral, it goes along hand in hand with some nerve. Which is that nerve? Nothing but the ulnar nerve. That's all, guys, you have to say. Okay, nothing but the ulnar nerve only. So next, it goes hand in hand with that ulnar nerve. Superior ulnar collateral also is coming out, right? At this point, the brachial artery is giving the superior ulnar collateral. Okay, now let us revise. Tell me, arteries. What and all you learnt about arteries? There is one brachial artery. Very good. That brachial artery will give one profunda brachii artery, which goes in the spiral groove, right? And then it gives some divisions. Then you have the superior ulnar collateral, which goes hand in hand with the ulnar nerve, right? Very good. And then you have a nutrient artery, which enters the humerus at this point. Okay, nutrient artery, which enters the humerus at this point. Okay, that's all. This is all about arteries. Done. Profunda brachii artery. This one is the superior ulnar collateral. Okay, this much is enough. And one more thing, that brachial artery from medial, it is becoming anterior. Brachial artery from medial, it is becoming anterior. Okay. So arteries is complete, guys. Now let's go to veins. Okay. Veins, two things you should know here. Two names. Brachial, definitely you know the name. And then you have to learn one more B. Basilic. Okay. So this basilic vein, what it is doing? No. It is piercing the deep fascia, it seems. That's all it will do. It's carrying blood, but what else it's doing? It is going to pierce. It's going to pierce the deep fascia at this point. Okay. That's all you remember about it. It's just piercing something. But what about brachial? You know, brachial, some two venae comitants of the brachial artery may unite to form one brachial vein. Why are they saying may unite? Okay, some two things will unite to form one brachial vein. Look at this diagram here, guys. We'll zoom it a little. See here, somewhere in the middle, they have some brachial veins, okay? It is arising because of some, around this brachial artery, some veins which are draining, right? Those will join together and it will form some brachial vein, okay? See, this brachial vein drains into axillary vein, okay? Basilic also becomes, basilic gets renamed as axillary, I feel. What do you say? So you understood, no, guys? So now let's go back to the list and continue. Last one is left, nerves. Yay, last one, nerves. Great. Our nerves are very happy. We are almost done. Now, what nerves are there here, guys? Everybody on earth knows the nerves that are there here. Come on, say. Yes, there is a median nerve. Then there is a ulnar nerve. Then there is a radial nerve. Who doesn't know? Right? Label them. Radial nerve, median nerve, ulnar nerve. 3. Okay, let's start with the median nerve. Okay. So median nerve, what is happening? See the middle line. Okay, median nerve, median nerve, median nerve, median nerve, median nerve, median nerve, median nerve. See, at this point, if you notice at the bottom, this median nerve and this brachial artery, they're crossing each other. Okay, so this point you have to remember. The median nerve is becoming medial of. It's coming to the medial side. Median nerve is coming to the medial side of the brachial artery. Okay. The median nerve crosses the brachial artery from lateral and it becomes medial. That's all. Median nerve is done. Next. What about ulnar nerve? So ulnar nerve is here. Let's see what and all is happening to the ulnar nerve. I don't see any problem with ulnar nerve. Ulnar nerve pierces the medial intermuscular septum with superior ulnar collateral artery. So that's what they said, right? Superior ulnar collateral artery and this one go together hand in hand, and this one pierces some intermuscular septum. Okay. This also pierces something, guys. Okay, ulnar goes and pierces. Then coming to radial. Now let's look at radial. Radial, not artery. I'm talking about this one. Radial nerve. Okay. So radial nerve, what is happening? It is also piercing some intermuscular septum, guys. So simple. It is also piercing something. That's all. It doesn't have anything. If you see here visually, nothing is there actually. So that will be piercing something. Okay. Along with something, it is piercing this radial nerve. Along with the radial collateral. That's all. Radial collateral we can see here. Along with that only. Okay. And it passes from the posterior to the anterior compartment. Okay. That is something else. It is behind the humerus and then it is coming. See. It is coming anterior, it seems. Okay. Radial nerve is coming anterior now. So here you can see, guys, that the radial nerve is becoming anterior. It was behind the humerus, right? It is coming anterior now. Okay. 2 more nerves we have to learn, guys. 2 more nerves are these 2 nerves. That is the medial cutaneous nerve of arm and medial cutaneous nerve of forearm. Okay, both of these they are saying it will pierce the deep fascia. Okay, arm and forearm, medial cutaneous, not the lateral one. Lateral also is there. Remember, in the medial side, medial cutaneous nerve of arm and forearm, they will pierce the deep fascia. Okay. Okay, so what are we looking at? We are looking at the changes at the level of insertion of coracobrachialis, right? So where does the coracobrachialis insert if they ask? So first thing you will say is it inserts in the medial border of the humerus, the middle part of the medial border of the humerus. Okay, now here what and all happens? What are the events that are happening? Bone. From circular it is becoming triangular. Okay, the shaft from circular it's becoming triangular. Then the facial septa, intermuscular septa, it's better defined below this point. Then muscles which insert here are the deltoid and coracobrachialis. Coracobrachialis only they have asked the question. Then origin. Which muscle originate here? Brachialis and triceps, the medial head of triceps. Okay, what happens to the arteries at this place? The nutrient artery, it will enter the humerus at this place. Then the brachial artery from medial it is becoming anterior. Then the profunda brachii artery it is going behind in the spiral groove, and then it is giving some descending branches, collateral branches. Then the superior ulnar collateral, that is again coming from this brachial artery only, that one is going along with the ulnar nerve, and what is it doing? It is piercing some intermuscular septum, right? Wherever IMS has come, intermuscular septum, just see I put it in brown. Then coming to veins, what is happening? You have the basilic vein and the brachial vein. Basilic vein is piercing the deep fascia. Remember, it's the basilic vein piercing the deep fascia. And then you have these two veins from some brachial artery joining together and becoming brachial vein. Okay, at this point. Okay, this word that you have to know for this vein is venae, two venae comitants, ants are there, comitants of the brachial artery. Okay, they join to form the brachial vein. Then brachial vein will further drain into the axillary vein. Okay, that is up above, not at this point. But coming to nerves now, guys, we have reached the last part, the nerves. So nerves, what happens? The median nerve. Okay, median nerve will be in the middle. Remember that median nerve, what will happen? It will from medial it will become medial of brachial artery. Okay, it will become medial. This median nerve will become medial of the brachial artery. So if brachial artery is here, this median nerve will become medial of the brachial artery. Okay, at this point actually it should be up above, we should write. Then ulnar nerve, what will happen? We already told you, along with this superior ulnar collateral artery, it will pierce the IMS, same thing. Okay, and then it will go off posterior. This ulnar artery. Okay, obviously it will go ulnar nerve, what will happen? It will go posterior, but I don't think it goes posterior at this point. It goes posterior somewhere here, right? Okay, then anyways, radial nerve it will come from behind like this, and then it will become of anterior. Okay, so radial nerve is becoming anterior. See here, radial nerve is becoming anterior. Okay, then ulnar nerve is becoming posterior. Okay, then median nerve is becoming medial of the brachial artery. Then there are two more nerves that you should know. Medial cutaneous nerve of arm, medial cutaneous nerve of forearm, they will both pierce the deep fascia. If you can remember. Now you have learnt all the changes that happen at the level of insertion of coracobrachialis. I think your brain has become a little heavy. Okay, the reason that we have learnt this is because in the recent anatomy theory final MBBS paper, they have asked this question for 5 marks, that too. So we have studied it. How much ever you can remember, please write. Bye-bye.